So what is Men's Health Month for? Is it truly all about men's health and benefits, or are there other agendas going on here? Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about sorting out medical fact from medical fiction. By the way, HEALTHdrum provides material for educational and informational purposes only and is not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. By the way, if you like to get fact-based healthcare information, please hit the subscribe button for me. Okay, so let's get into it. So Men's Health, Prostate Health, Prostate Cancer Awareness, and Blue September are all marketed as being of men's health benefit. But is this truly the case? So let's see what's all included under men's well-being. This is a target-rich group and includes Men's Health Month. This is a broad, holistic field that encompasses the prostate, but other healthcare concerns such as heart health, mental health, hormonal health, fertility, diabetes, kidney function, and so on. However, the other targets in the men's well-being category are prostate health, prostate cancer awareness, and Blue September. As we proceed, we'll see if the recommendations promoted by the prostate cancer lobby are of real benefit, or whether it's more about using weaponized information to exploit fear and push men into over-testing and over-treatment for prostate cancer. So what are some of the many claims made by the prostate cancer lobby about Men's Health Month? So here's a list of some of the many claims made in support of Men's Health Month. Prostate health, prostate cancer awareness, and Blue September. They all revolve around the subject of prostate cancer detection and treatment, and that early prostate cancer detection allows treatment of cancer before it can spread, that early detection gives you more treatment options and less aggressive treatment options, and early detection and treatment result in less treatment complications. However, these claims from the prostate cancer lobby also imply that early detection and treatment can save lives. Sadly, all of these are unproven claims. Also, the prostate cancer lobby claims that urinary and sexual symptoms are early warning signs of prostate cancer. This is absolutely untrue and pure deception, as urinary and sexual symptoms are merely signs of aging. Also, about these many claims for undergoing prostate cancer detection are claims about risk factors. So the following prostate cancer risk factors are commonly marketed during Men's Health Month, Prostate Health, Prostate Cancer Awareness, and Blue September programs to get men channeled into prostate cancer testing and treatment. Obesity seems to be associated with more aggressive prostate cancers, as are those that have a family history of prostate cancer, those with an African heritage, older men, and those with hereditary gene mutations such as the BRCA1 and 2, the Lynch syndrome, and others. However, knowledge about these risk factors is of unproven benefit. So let's look at the term prostate cancer. Are all prostate cancers equal and potentially dangerous, or can many of them simply be left alone? Although the term prostate cancer is used as if all prostate cancers are equal and dangerous, this is far from the case. The majority of prostate cancers grow sluggishly, taking some 40 years or more from the time of mutation to reach 1 centimeter or about half an inch in size. As well, most prostate cancers are outlived. The Gleason 6 is a pseudocancer, and only about 10 to 15% of prostate cancers are high grade and potentially dangerous. Prostate cancer, therefore, is a spectrum of diseases, and many of them can be left alone. Although many prostate cancers are outlived, the messaging from the prostate cancer lobby seems to imply that all prostate cancers are dangerous and need testing and treatment. But is that true? So this screenshot summarizes the similarities in the messaging for Men's Health Month, Prostate Health, Prostate Cancer Awareness, and Blue September. The messaging is promoted as being of great benefit for men's well-being, but clearly its primary focus is aimed at channeling men into getting tested for prostate cancer. The messaging is aimed at men, often middle-aged and older. There's a public messaging angle using slogans, catchwords about health, awareness, and prevention. The messaging is typically in campaign style with media coverage of events, screenings, fundraisers, and support groups. And the underlying driver here is to channel men towards prostate cancer testing. Unsurprisingly, this messaging blurs the lines between health education and marketing. As well, the emotional tone exploits the fear of cancer to mobilize men, donations, and policy support for the prostate cancer industry. In essence, prostate cancer messaging is pure fear-based marketing along with exaggerations and misinformation about prostate cancer. So what sort of campaign events can be expected during Men's Health Month, Prostate Health, Prostate Cancer Awareness, and Blue September? You will notice that the prostate cancer lobby has targeted men twice. First in Men's Health Month, normally done in June, and then again in September with Prostate Cancer Awareness Month. Typically, communities and reporters are exploited to get their involvement to promote false prostate cancer messaging. Various programs are utilized such as sports partnerships, golf outings, charity runs and walks, as well as community and hospital seminars, galas, and social events. As well, businesses have been fooled to sponsor many screening events. The major problem with this messaging is that the health dangers of prostate cancer testing and screening have been packaged as health benefits. So what sort of screening tests are recommended for Men's Health Month, Prostate Health, Prostate Cancer Awareness, and Blue September? So these are the two tests that are commonly recommended for Men's Health Month, Prostate Health, Prostate Cancer Awareness, and Blue September. The first test is the digital rectal examination, or DRE, or prostate exam, and the second test is the prostate-specific antigen blood test, or PSA. So let's see where the prostate is located. So in these side-by-side sketches of prostate location, you can see that the prostate is located below the bladder and in front of the rectum, and the urinary channel goes roughly through the middle of the prostate. So how reliable is this prostate exam, or DRE? So the prostate exam became commonplace because it was discovered that some prostate cancers can feel hard. The prostate exam can be undertaken with the patient bent over the examining table or lying on one side. It takes only a moment, but can be quite uncomfortable for those that have hemorrhoids, anal fissures, or anal stenosis. Also, the prostate exam has several reliability concerns, the most important being that you are relying on the judgment of the practitioner to be able to feel an abnormality. Clearly, different practitioners will have different interpretations about what they're feeling. Also, nodules need to be at least about 1 centimeter in size before they can be routinely detectable. And nodules deeper in the prostate will need to be bigger before they can be detected. On the other hand, most prostate abnormalities, nodules, or irregularities are benign and not cancerous. As well, there's no evidence that prostate exams save significant numbers of lives. More importantly, the prostate exam, or DRE, fails to meet the criteria necessary to be a useful screening test. The bottom line here is that the prostate exam, or DRE, is a medieval junk test, unreliable and unjustifiable. What about the PSA test? How reliable is that blood test? So the PSA blood test has a great number of reliability concerns. It has a false positive rate of about 78%. Its specific label is a barefaced lie, as it's not specific to the prostate or for prostate cancer. Its levels of 0 to 4 being normal are false and made up. And typically, big prostates generate big PSAs. As well, most of the cancers detected are because the PSA was generated by the BPH and not the small indolent cancer found. So here are even more reliability concerns about the PSA. PSAs fluctuate normally during the day and between different labs. They are easily raised or lowered by various benign processes. They are lowered by various prostate drugs and cholesterol drugs and others. And when you come off these drugs, the PSA will rise. As well, PSAs are easily raised by urinary tract and prostate infections, prostate checks, catheters, and so on. Also, a low PSA doesn't mean no cancer, and a high PSA doesn't mean you have cancer. On the other hand, high-grade prostate cancers, which are potentially dangerous, may produce little or no PSA, so they can be easily missed on screening. Clearly, the PSA test, like the prostate exam, also fails as a useful screening test. So do these prostate and PSA screening tests save significant numbers of lives? So the important criteria for any screening test to be useful is that it leads to the detection of disease early enough so that treatments can save significant numbers of lives. Yet, not only are both these tests highly unreliable, but neither of them have any ability for saving significant numbers of lives. However, despite these glaring failures, physicians helped engineer an FDA approval for the PSA test to be used in prostate cancer screening. Subsequently, urologists' own studies showed that PSA testing fails to save significant numbers of lives. Even more concerning about prostate cancer screening is that any abnormalities found on the prostate exam or with PSA testing leads invariably to more risky prostate needle biopsies. So the tests for prostate cancer screening fail to save significant numbers of lives. What about prostate cancer treatments? Do they save significant numbers of lives or only lead men to health dangers? So the evidence shows that at about 20 years, those that had no treatment had similar survival rates to those that had aggressive prostate cancer treatments. Men who chose monitoring lived just as long, but without all the lifelong complications normally associated with aggressive treatments. And men who chose monitoring avoided all the routine complications. Clearly, quality of life matters. As well, decades of data exposes the false promise that rushing into treatment guarantees survival. And real-world evidence destroys the prostate cancer narrative that early or more intervention equals better outcomes. In other words, the many claims about the benefits of prostate cancer testing and treatment are not supported by the data. Remember, the links to all the material in this video are in the description below. So what does Men's Health Month, Prostate Health, Prostate Cancer Awareness, and Blue September really do for men? So Men's Health Month, Prostate Health, Prostate Cancer Awareness, and Blue September are all troubled by the same marketing ploy, the unproven claims that prostate cancer testing saves lives. This is a circus that's built on fear-mongering, falsehoods, and shameless exaggerations. Even businesses have been fooled into sponsoring misguided prostate cancer screening events. Urinary and sexual symptoms are not cancer red flags, but merely signs of aging. The prostate exam and the PSA testing for prostate cancer fail to save significant numbers of lives, and invariably, any abnormalities found on these screening tests lead to more risky prostate needle biopsies and prostate cancer treatments that lack irrefutable and reproducible data for saving significant numbers of lives. It's nothing short of outrageous that Men's Health Month, Prostate Health, Prostate Cancer Awareness, and Blue September have been hijacked by the prostate cancer lobby, and that prostate cancer testing and treatment is enshrined as standard of care when the tests and treatments fail to be life-saving. In contrast, these programs simply lead men to health dangers. Not only has there been abject failure of healthcare regulatory oversight for protecting the healthcare public, but this ethical negligence has allowed the squandering of billions of precious healthcare dollars by an epidemic of over-testing and over-treatment, delivering only a global public health disaster. So let's recap. In this video, what is Men's Health Month for? You learned that Men's Health Month, Prostate Health, Prostate Cancer Awareness, and Blue September have been hijacked by the prostate cancer lobby. You learned that prostate cancer testing and treatment is highly unreliable, and you learned that prostate cancer testing and treatment fails to save significant numbers of lives. To learn more about routine medical care, self-care, and digital health, check out these other videos, and if you like them, please share them with your friends.